Let's talk about a condition that affects many women but is often not discussed openly: pelvic organ prolapse or POP. Don't worry, we're going to break down this complex medical term into simple language. Imagine your pelvic floor as a hammock of muscles supporting the organs in your pelvis, including your bladder, uterus, and rectum. Pelvic organ prolapse happens when this hammock weakens or stretches. As a result, one or more of these organs can drop or press into the vagina. This might sound a bit scary, but understanding POP is the first step towards feeling empowered to manage it. Remember, you're not alone. POP is more common than you might think, and there are ways to treat it and improve your quality of life. Now that we have a basic understanding of what pelvic organ prolapse is, let's delve into which organs in our bodies can be affected by this condition. Pelvic organ prolapse, or POP, is a condition that can impact multiple organs within the pelvic region, leading to various symptoms and complications. As mentioned earlier, the pelvic floor supports several organs, and any of these can be involved in POP. These organs include the bladder, uterus, rectum, and sometimes even the small intestine. Each of these organs plays a crucial role in our daily bodily functions. The most commonly affected organ is the bladder, and when it drops, it's called a cystocele. This condition can lead to symptoms such as urinary incontinence, frequent urination, and a feeling of pressure in the pelvic area. You might also hear it referred to as a dropped bladder. This can be particularly uncomfortable and may require medical intervention to manage effectively. Next, we have the uterus, which can also slip down, and this is known as uterine prolapse. This condition can cause symptoms like pelvic pain, difficulty with bowel movements, and discomfort during sexual activity. Lastly, there's rectocele, which occurs when the rectum bulges into the vagina. This can lead to symptoms such as constipation, a sensation of fullness, and difficulty with bowel movements. It's important to remember that sometimes more than one organ can be involved in prolapse, making it even more crucial to seek medical advice if you suspect something is amiss. Early diagnosis and treatment can significantly improve quality of life and prevent further complications. We've discussed the organs that can be affected by POP, but did you know that there are different types of prolapse? That's right, not all prolapses are created equal. The type of prolapse depends on which organ is affected and the severity of the condition. We've already touched upon cystocele, rectocele, and uterine prolapse. However, there's another type called vaginal vault prolapse. This occurs after a hysterectomy when the top of the vagina loses support and drops. Knowing the different types of prolapse can be helpful when discussing your symptoms with your doctor. They can use this information to determine the best course of treatment for you. Section 4. Causes and risk factors. What causes pelvic organ prolapse? Well, it's usually a combination of factors that weaken the pelvic floor muscles and ligaments, leading to prolapse. One of the biggest culprits is childbirth. Vaginal delivery, especially of a large baby or after a long labor, can stretch and weaken the pelvic floor. Aging is another factor, as our muscles naturally lose strength as we get older. Other risk factors include obesity, chronic constipation, heavy lifting, and even genetics. Knowing the causes and risk factors can help you make informed decisions about your health and potentially reduce your risk of developing pelvic organ prolapse. Section 5. Symptoms and diagnosis. Many women with mild cases of pelvic organ prolapse experience no symptoms at all. This can make it difficult to detect the condition early on, as there are no obvious signs to look out for. However, as the condition progresses, you might start noticing a feeling of pressure or fullness in your pelvis or vagina. This sensation can be persistent and uncomfortable, affecting your daily activities and overall quality of life. Some women describe it as a feeling of sitting on a small ball. This unusual sensation can be alarming and may prompt you to seek medical advice. Other common symptoms include difficulty emptying your bladder or bowel, urinary incontinence, painful intercourse, and lower back pain. These symptoms can vary in severity and may come and go, making it challenging to pinpoint the exact cause. If you experience any of these symptoms, it's important to consult your doctor. Early diagnosis and treatment can help manage the condition and improve your quality of life. Diagnosing pelvic organ prolapse typically involves a pelvic exam, where your doctor will assess the strength of your pelvic floor muscles and check for any organ prolapse. This examination is crucial for determining the extent of the prolapse and planning the appropriate treatment. Your doctor will also evaluate other factors that might be contributing to your symptoms, such as muscle weakness or connective tissue issues. They might also recommend imaging tests, such as an ultrasound, to get a clearer picture of your pelvic organs. These tests can provide detailed information that helps in creating a comprehensive treatment plan tailored to your specific needs. Section 6. Treatment and Prevention. The good news is that pelvic organ prolapse is treatable, and you have options. There are various approaches to managing this condition, ranging from non-invasive methods to surgical interventions. Treatment depends on the severity of your prolapse and your symptoms. Your healthcare provider will work with you to determine the best course of action tailored to your specific needs. For mild cases, lifestyle changes, such as losing weight, can make a significant difference. Maintaining a healthy weight reduces the pressure on your pelvic organs. Doing pelvic floor exercises, commonly known as Kegels, can strengthen the muscles that support your pelvic organs. These exercises are simple and can be done anywhere. Additionally, avoiding heavy lifting and learning proper lifting techniques can prevent further strain on your pelvic floor. Your doctor might also recommend a device called a pessary, which is a removable device inserted into the vagina to support the prolapsed organs. This can be a great non-surgical option for many women. The pessary can be easily managed and adjusted, providing relief and support without the need for surgery. In more severe cases, surgery might be necessary to repair the weakened pelvic floor and reposition the organs. Surgical options vary, and your surgeon will discuss the best approach for your situation. Prevention is key. While you can't control all risk factors, being aware of them can help you take proactive steps. You can strengthen your pelvic floor muscles with regular Kegel exercises, maintain a healthy weight, and stay active to support overall pelvic health. Additionally, eating a fiber-rich diet and staying hydrated can help you avoid straining during bowel movements, which is crucial for preventing prolapse. Remember, early detection and treatment are crucial for preventing complications and maintaining a good quality of life. Regular checkups and open communication with your healthcare provider can make all the difference.